Is this thing on?
I am Queens.
Hi, everyone. My name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. Okay, y'all, we are back, and I am with my friend Juliana, or Jules, as I like to call her. Jules, introduce yourself, boo.
Hey, what's going on, everyone? I'm Jules. I am a physical therapist in Boston who specializes in working with runners and women who are postpartum and want to get back to exercise. What's going on, Alyssa?
Jules is one of my best friends from PT school, and I think it's funny that she's working with postpartum mamas now because I remember when there was a time where she
The
was
early
not
days.
sure. Yeah, where she was not sure if she would want to go into pelvic floor. And she is an amazing orthopedic PT for sure. And I'm just loving that you're getting into more pelvic floor stuff now. But I definitely wanted you on here, which I would have had you on here anyway. However, I wanted you on here because she started her own business during the pandemic, and I kind of want you to just dive into it a little bit, boo. Just like tell us what your business entails and kind of like what your vision is for it too.
Sure, yeah. So last March, my company laid off 100 physical therapists, and I was kind of in a crossroads like, shoot, now what? I always wanted to start my own business, but I didn't know like where to kind of start. And my friend Jess from Wanderlust PTs, she was my mentor, and she kind of helped me get everything off the ground, the back work in terms of starting a website, getting my PLLC started, etc. And when I was deciding like who I really want to service, I was like, I worked in pediatrics for 6 months prior, and I had a lot of my moms coming to me being like, so do you work with like adults too? And I was like, yeah, actually, like we have our ortho side. And they were like, we're having some back pain or some just like, postpartum like concerns in terms of like they want to work out again and they don't know where to start. And I was like, like there's like some interest in this, and definitely these women are not getting the care they need. So I decided to take my knowledge as a runner and like my years of experience working with runners and help women postpartum get back into running safely. So I primarily help to empower postpartum moms get back to running so that they could cross their next finish line and have less injury when they do that. So my business, Pacer Physical Therapy, I help those moms to get there and kind of fill that gap where, doctors say come back for your 6-week checkup postnatally, but what about before that? If you want to do something, is it safe? Or what about after that? When is it ready to do a push-up or a plank or run, right? So that's what I'm trying to advocate for and trying to, help these women feel comfortable doing.
So I'm obviously obsessed with everything that you just said, naturally. Not just because you are my friend. If this were a different physical therapist saying this, I would obviously be obsessed with it too. Now, obviously, I see a lot of moms during pregnancy, afterwards, beforehand, even before they get pregnant too. Like a lot of them want to come in, like get a lot of information. But I am a PT where it's like, okay, I know about running, but I know about running because of you, Jules. Like I know about running because of you, and I know about it because of another one of my friends from my previous job. So it's like you two have taught me a lot about that, and I'm able to now help runners in that way too. But when it comes to kind of higher level athletic things, like where I fall when it comes to that. Like I do not like teaching most high level stuff. All my patients know this too. They know that if they want to like try some sort of sport, I'm like, I'm like, I don't, can I help you pee better? Great. And I'm happy to do that. But when it comes to the more higher level stuff, this is where I like finding people that are in more of a niche, that like those moms that do want to do like planks right away and stuff. And of course, I am more than capable of teaching that, like those things. However, I, even right now, I have this mom that's seeing me and she is so high level that I was so straight up with her on her evaluation. I said, listen, I know I can help you, but I know that like the long term stuff, I don't necessarily know if like I'm the right person to help you with. It's even like a lot of the athletes that I see. I do treat a lot of like football players and stuff, and like with them, they're like, Alyssa, can you help me with like this drill or this drill? And I'm like, I don't think you want me helping you with that.
Hey, we all have our specialties.
Right. Exactly. Exactly. So that's where I think it's so cool that you do have this niche. I also love that it kind of came out of, I don't want to say it came out of nowhere for you, because like I know running has always been very important for you, but just the niche of postpartum as well.
Yeah, and I think like in our age group, we start to see more of our friends getting pregnant. I have cousins and other people, and they're like, they just don't know where to start. And like, I wound up taking a postpartum corrective exercise class with Sarah Duvall, who's awesome. And I'm still like in her inner circle with tons of other PTs and personal trainers, doulas, tons of people in the field. And it's just great to like collaborate with them, because everyone is all on this concern of like, where did we go wrong with not providing this care for women, especially because it's not like the old days, right, where you're like, oh, just relax at home with the baby, or just don't worry, you'll feel better. It's like, no, these women are go-getters. They want to get it back out there. They want to work out. They want to be in good shape. They want to feel good. They have health goals. And like, it's just us being out there supporting them in that. And, there's clients of all levels. Like I had an ultra marathoner, and she ran a half marathon the day before she delivered her baby, and I was like so impressed with her. She had found me, and she was like, listen, Juliana, like, I have goals. Like, I want to get back into running. She had a C-section. She's like, I just don't know where to start. I don't feel myself. Like, even sitting up in bed hurts. And I gave her a 12-week program. She was super independent because she had worked out before, but she just needed that extra assistance. Like, when's too much, or like, what do I need to really work on?
Sure.
And in 12 weeks, she was running, right? Like, she was back to it. And she's just like, just filling that gap for me made me feel that much more confident and that much more knowledgeable on like how to take care of myself. And that's what I want to provide for my patients, like make them feel good about like where they're going to. And it's tough too with our healthcare system. Like, this woman did not have any pain, right? And if you don't have pain, is insurance going to cover it? Yeah. And if it's preventative medicine, is it going to be something that you are going to be able to get a prescription for? And that's also another conversation I'd love to have with you. Like, what's your thoughts on that?
Yeah. And I definitely have a lot of thoughts on that, because I think that there are plenty of gaps in our healthcare system. So, I mean, you had a few really, really good points there. So this mom, clearly, the one that you were talking about that like ran the marathon the day before, she had the half marathon, but even so, that's like intense, before having a kid. For somebody like her, she is somebody where like, especially since she didn't have pain and things, that's something that's going to be very hard to get covered under insurance. And we know that firsthand. I can count, oh my gosh, there are just countless amount of times where I've had to call insurance companies and say like, I've literally said to somebody before, like, if you had something wrong with your vagina, what would you do? And like that's when they like backtracked and they're like, okay, here are 5 more visits. It's kind of like, and I hated sometimes to do that, but like that is what people need to hear in order to give more visits, which is terrible. It's so terrible that that's the case. But you brought up a good point with that. is insurance going to cover it if it's preventative medicine? So I think that that's something that everybody kind of needs to work on. A lot of people think that you need to go to PT when you're in pain, whereas now a lot of my patients, they come in and they're like, I don't want to be in pain, like after like postpartum, or like I don't, is there anything that I can do to help my abdominal muscles, maybe, to help me lift the baby postpartum? Like, so many people are coming in, but that's also due to networking. Like I have a doula that refers to me all the time because she was like, I know what pelvic floor PT can do. Like, you need to go see one before you have the baby. So it's like networking with all these providers is important. But even last week, I had to call a spine specialist. I had to call somebody's gynecologist and explain what I do every day. I had to explain to them what my sessions entail. A lot of them kind of deem us as regular PTs. I kind of hate to use that word. I don't want to say
well,
like
yeah,
regular.
they're not maybe understanding your specialty,
Right.
like
Exactly. Where they're just kind of like, what are you teaching there? Is it just exercises? Whereas like I had a mom who's having painful sex, and I was like, actually, no, that's not all I'm teaching her. I'm teaching her how to use a dilator or a pelvic wand, and I'm teaching her how to assess her pelvic floor, to see like when it's painful,
yep.
to help to calm it down. And they were like, oh, like, and it was funny because the doctor that I spoke to, she was like, I had no idea. And she was like, I'm kind of baffled by this right now, that I literally had no idea. And she was like, where can I find you guys? And then she like researched pelvic floor PT, and she was like, oh my gosh, like why, and she was like, now I'm going to start to refer people. So it kind of, a lot of doctors, they just need that simple phone call as well from us. They need that simple phone call to be like, okay, cool. Whereas sometimes when a patient will go back to them and say, oh, I'm going to pelvic floor PT, a lot of times, unfortunately, a patient isn't, they're not like empowered enough, like they're kind of,
well, yeah, I mean, if your OB is like, oh, like, sorry, you have a little pain, it should subside, like, how are you gonna feel? Or even if it's like, I want to get back to exercise, oh, just wait like one more month, like what does that really mean? What's gonna change? And I was actually pretty excited when I spoke to a doctor on the phone, because she was like, oh, actually we refer a lot of people to pelvic floor PT. And I was like, oh, do you mind if I ask, like, what kind of conditions are you referring? And a lot of them had to do with pain, which bothered me a little, but also made me feel like really good that they even know about pelvic floor PT.
right.
But I'm like, if we could just get PTs like in the delivery room after the baby's born with the mom and say, hey, after a C-section, you need to be able to do this, this, and this. And this is how you can do it safely, because we all need to get up from when we're lying down in bed, right?
Yeah.
So how about we just teach them how to roll on their side and get up in a little bit of safer way, how to go up and down stairs in a comfortable way. Like, there's research on there that says you shouldn't go up and down stairs after you have a C-section. And women read that and they're literally like, my husband goes up and down stairs for me. And I'm like, whoa, yes, that's kind of true, but also that's kind of not true. Like, right. Can we turn you sideways and have you go up the stairs that way? Like, can we teach you different things that if we taught you that as soon as you delivered, you'll feel great going home because you'll be like, oh, I know what to do. Exactly. And I just feel like that is our missing gap in our healthcare system here. And if my mission is to really educate people so that they feel comfortable with anything postpartum. And it goes from literally delivery till 5 years out, right?
Yeah.
Postpartum is forever. So like, you don't have to be a new mom to see me. You can say, hey, I finally feel like I have some time, and let me now get into running and like feel good about it, and let me dedicate this time. And I have all virtual sessions, and it's to make people feel very like comfortable because they're in their own home. And then also give them like just enough, like whenever they want to see me, they can see me, right? It's easy.
Yeah.
Go on your computer, boom.
Yeah.
And I love the thing that kind of happened with COVID. Like, the one good thing is like being able to expand yourself outside of just your one city or state, right? You could work with people all over the country, all over the world, and people are a little bit more open to virtual. And at first I had my doubts. I'm not going to lie. I was like, virtual PT, virtual like training. Like, I don't know if people are going to like this. I don't know if I'll like it. And it definitely was a big learning curve, but it definitely just helps to advocate more for like a population, give them that opportunity that they might have not had if they were in like a rural area, or if they didn't have anyone in the area that specialized in that. So I think that's pretty cool.
1000%. Now, I mean, I think there was just one word that obviously stuck out to me, and it was just education. So, whether you're doing that virtually or in person, I think that that's super important. Now, for me, I have done virtual, and I think, of course, I prefer in person. I think like anybody would prefer
Oh
in
yeah.
person than anything. But there have been a bunch of people, whether that's like from Instagram or if it's from, or like a friend of a friend that's just like, I'm not in the area, but like, can I give you a quick call? Like, I actually did that with a friend, like an old friend from high school the other day. And she was like, are you kidding me? Like a lot of the stuff that you just sent me, like super quickly, it's stuff that I can just do at home. Like that has helped me more than even like one of my in-person sessions with like who I've been seeing. And I was like, that's great. Like that's awesome, because sometimes it's just like, and I mean, we know this more than anybody. It's like sometimes you're like not gonna vibe with your healthcare provider, and like that's okay. Like then it's time to either see somebody else or whatever it is. But she was saying, she was like, I can't believe like virtually, just with that education that I have, she was like, I have been walking around with certain pain, but I've been told to rest. And I was like, so while I understand that concept, I think that it's very important to teach people that like movement is medicine. So like while sometimes working through movement might be tough and it might be painful, like it's still better to move than it is to
Motion
rest.
is lotion, baby.
That's right. It is.
Yeah.
But that's even just like a big thing that like you post all the time too. It's just like keep moving. Just like just move. Just move in general. Yeah,
and
it's a big part
that's
of it.
been like one of the tough parts. I'm sorry to interrupt you, but
No,
that's
it's
been
okay.
like one of the tough parts with COVID. Like there's so many people working from home, and like even I have patients coming all the time that are like, oh, like I used to walk like to and from wherever, whatever, to work, to get food, to meet up with coworkers after work. And it's like, I don't move throughout the day. And it's like just educating people on like moving more, or like standing and sitting more and not just sitting. Right. And that's also like something that's been tough, with COVID. But I think also like just with the weather getting nicer, at least that's going to help. Right.
Totally. And I actually, to be honest, I think that that is a big part of things too. Like all my patients, and then even including myself, I was like, guys, like my mood is just better. Like with the sun
Oh,
out.
yeah.
We also had a very cold winter. Like it was cold and things weren't open. It just, there was all these factors that kind of led into it. There's an uptick in numbers, when it was cold. It was just, there was all these things that were kind of going on that I think led people to, of course, not move enough. A lot of people weren't comfortable going to the gym. And for some people, going to the gym is their outlet. So it's like, if you don't have that, yeah, there are a lot of factors that went into it. But that kind of leads me into the topic, though, of moms not really being looked at as much too. I've actually talked to a few patients about this with like pandemic wise. A lot of moms kind of aren't being looked at as like being home with their kids. Moms not having the care that they needed postpartum too, especially during this time. There was actually a big article in the New York Times about it, like kind of recently, I think maybe like a month or two ago about it. And I was like, oh wow, I'm happy that they're actually bringing light to this now.
Yeah, totally. I mean, I think about people like clients and even family members who had kids during this time, and it's been like tough because like cousins, aunts, uncles haven't met their kids, and they're home. They're at home, and like if they had a child in the winter, it's like really hard to like either even to get an appointment, right? Some of them are like, oh, my 6-week checkup got pushed out like another 6 weeks, and I'm like, what? You haven't seen anyone in 12 weeks?
Yep. Yeah.
It's been really challenging, and it's just good like for us to like keep saying like we're here, right? Virtually we're here. We'll take a 15-minute phone call to help talk you through things, to make you feel more comfortable, and also to educate you and make you feel empowered to start doing something. You don't have to wait 12 weeks. That's insane.
Yeah. 12 weeks is like Well, that's like genuinely insane because even
I
sometimes
had
for
someone like that. Crazy, right?
yeah, because even there are some moms where I'm just like, honestly, like personally, I think you could come in before 6 weeks, like, because it's true, they're
Oh
finding that
yeah,
the
totally.
quicker that people come in, the better, like and we go from there. Like even one of our friends, like I even saw recently, and like it's before her 6 week checkup, but like she needed, she needs help just like with lifting and with her back pain and with moving and things too. And like her midwife cleared her. They were like, yep, please see somebody. That's
Well,
fine.
that's
Or
another thing I think we have to tell our ladies about. Like, we're not just going to push you into exercise,
yep.
and you're not going to be doing squats at week 2 necessarily, although you do sit and stand, and you got to be able to do that.
Yep.
But we're going to do it in a way that we know is safe for you. So like, it's never too early to see a pelvic floor PT or someone who specializes in postpartum care. And I think that's another thing that we got to spread to our postpartum ladies, is like, go see someone, go seek it. And if it's not covered by insurance, just know like this can be preventative for injuries in the future. And whether you're a high level like athlete, like my ultra marathoner, or I had another client where at 14 weeks during her pregnancy, 14 weeks, her doctor's like, well, I don't know if you should lift anything more than 15 pounds. And this girl was a superstar CrossFit athlete. And I was like, did your doctor say why? Like, I'm so confused.
Yeah.
She's like, no. And I'm like screening her for all of these, like this, like any health conditions. No.
Nothing,
so she literally did nothing from 14 weeks pregnant onward. Okay. And now she's coming to see me and she's like, I'm so out of shape. When can I start? She's like anxious to get going. And I'm like, week 1, let's go. Breathing, boom, boom, boom. Just like helping her reconnect to everything. But it's like, holy crap, Alyssa.
Yeah.
What do you think about that?
I mean, okay, first of all, 15 pounds. If she has a kid,
well, she's pregnant right now.
She
doesn't have any kids.
Oh, okay,
when
I'm sorry.
She was 14 weeks pregnant, and they said not to exercise.
Wow. Okay. So that goes into, I'm sorry, I misheard you before. So that goes into like the misconception though of people not realizing how important movement is. Like a lot of my pregnant moms have come in saying that, like, my doctor told me not to do this, but then it's also like not on their prescription. So I'm like, why? Like, what, like, why can't you lift this amount? Or like, why can't you do this? And they're like, oh, I don't know. I think it's something that's just ingrained in practitioners' heads, like, oh no, if somebody's pregnant, they shouldn't be doing this, they shouldn't be doing that. And it's just one of those things that like becomes known. It's the same thing as just like, oh no, mom should be resting, they shouldn't be moving around. And then my counteract to that, what I say to my moms, and I'm like, well, what you gonna do when the baby comes? what are you gonna do then?
Well, that's how my client feels right now. She's like, I literally have not worked out since 14 weeks. She was pregnant, 14 weeks in, they were like, no more working out. So she has not worked out for months. And so I wanted to tell you about this if you don't know about it. I took a course, and the course was actually the two people who taught it were from Canada, and they told me about this. And it's a physical activity readiness questionnaire that I give my pregnant ladies, because it's just like, like what their level of fitness was before, the intensity, like what they want to lift, like any like their status of their pregnancy and how they're feeling. And then like their doctor fills out like if they have any like precautions, right? And it makes that like fluidity a little bit clearer. Like you have it on a document that you're giving the doctor, and you're saying like, this is what I want to do. And then they give me the sheet back, and we can help like make them a good pregnancy program. Because like a lot, like my clients, like, why did she have to stop exercising at 14 weeks? And if I gave her this evaluative thing to fill out beforehand, it has like, healthy eating and like different like types of education for the patient too. But it's also good for us to like keep that like communication between their doctor and us, right? Because then it's like making us like feel like we're involved with them, and then making the patient feel like empowered. Like, I want to work out, tell me why I can't, or tell me what you want to like me to focus on or not focus on because you think it's harmful for me or the baby. You know what I mean?
I think that's cool. I like that. I actually didn't know about that questionnaire. That's awesome, because like you said, I feel like then it kind of tells you like, okay, I can do this, or like I should be working on this. And like it gives you kind of like more data, kind of like for
Yeah, and it
yourself and for
has
the
like
patient.
maternal age starting at 20 and then going up to 40. So it's like a
Awesome.
big age range for women who are pregnant, and it helps to like develop a good program for them. Like, cause I have women who are, like I said, like running half marathons before they deliver. And it's like, just like help give transparency. If the doctor doesn't know your goals, then how are they going to say you can exercise or not when you're pregnant? Right.
Yeah.
And this, I feel like, helps to make that conversation easier for the patient. Especially I have someone, they were like, my family's judging me for running 5 to 6 miles a week and I'm 30 weeks pregnant. And I'm like, how can we make them feel more comfortable? Right. Like, how can we show them that the doctor is clearing you to do that? Can we show them that you are a very healthy individual and strong? Like, how can we make your family feel good about you wanting to stay fit and work on your fitness goals, and know that you're still eating right and sleeping right and taking care of your body? Like, they shouldn't feel limited, So I'll shoot you over this questionnaire. I really like it.
That's amazing.
Anyone else who wants it, we could spread the word.
Yeah,
but
of
when
course.
I found it, I was like, this needs to be out there.
I'm so happy to like share that with like my colleagues and even like on Instagram and stuff, so that like other practitioners can see it and stuff too. But that's interesting though that you brought up that her family was feeling uncomfortable. I also think that kind of goes into like the psychosocial aspect of our job too, is to say like, because we do have to ask those questions like, why do they not feel comfortable with that? Was this mom running a lot beforehand, before she was pregnant too? So like, that's why she feels comfortable running now, like the 5 to 6 miles and stuff. So it's like all of those things come into play, but I think it also just goes into how our job is a combination of like a lot more than just the physical a lot of the time too.
Oh, heck yeah, girl.
Right?
I know.
A lot of education, a lot of, like you said, like we might not even teach exercises on one of our visits, oddly enough. That might not be it. It might be like, can you get up the stairs? Okay. Because like, I'm going to show you how to do that, and I will gladly show you how to do that. I had a mom come in the other day, and she did bring her baby with her, which I'm all about. I'm completely all about that. I love it. I love the kiddos. And
can I interrupt really quick? I had a mom doing squats with her baby this morning. She was literally going down overhead press. I'm like, I'm laughing because the baby's laughing, and I'm like, this is great.
Amazing. It's amazing. Yeah. And I think it's great, honestly, when they, when they bring their kids into the sessions, because one of her first complaints was, I've been having trouble lifting her. And I went, oh, well, here she is. I was like, show me how you've been lifting her. And oddly enough, poor mom was hunched over. She was like leaning too much into her back onto one side. And it's like, then I taught her how to do that and to kind of like work through it. And she was like, you've got to be kidding me. She was like, this is what I had to do. And it was just like, it ended up being
the little things.
Yeah. And it ended up being like simple, quote unquote. It's not easy to be like that body aware, especially when you're dealing with taking care of another human now, at this point too. But those are the things that I just like love to teach though. It's like breaking little habits. I talk to my patients about that all the time. I'm like, I can give you a million different exercises, but like if you don't break certain habits, you're probably not going to get better. And that just is what it is, right? And
well, that's like, again, that's all with the education. I think, you asked me like how I got into this too. Like, I like to educate as part of how I practice. Mm-hmm. And like, this has been a whole new opening, like for me, because I also love to prescribe exercise. So it's finding that balance, right? But I think it's been great because it's just like saying like, oh, okay, we're working on your posture, but hold on one second. How are you carrying your child at home, right? Are you just carrying them on the right side? Is that why the left side of your back's all jacked up? What's actually going on, and diving into it deeper. And, you might not have pain with that. You might not even have pain with that a year or two later, but then you have 2 kids and you're carrying them like that. And you have 2 kids that might weigh more. And you're like, 5 years later, why is the left side of my back still jacked up or just jacked up? And it's like, well,
yeah. And I was actually, that's something that popped into my head when I was talking about the mom who brought in her daughter. a funny thing is sometimes when mom will come back to me, let's say like a month later, or like they'll shoot me an email like, oh my gosh, it's kicking on again. What is going on? And I remember I called one of my previous patients and I was like, I had to call you for this one because I was like, you are going to laugh at what I'm going to say to you. And she was like, oh God. She was like, what? And I was like, your baby's growing, right? I was like, your baby's growing, just so you kind of also need to, and this is a huge thing that I teach with my moms. It's like, you now need to know that like the baby is going to grow, like so you're going to have to deal with like lifting a bigger kid, like as you keep going throughout this journey, and know that things are also going to change. So it's like, okay, I taught you how to like contract your abdominal muscles, but like what else do you need to do now? Like, do you need to lift through your legs a little bit more so that you're not overusing your back? Like, what else can we now do? And it's something that I always tell them. I'm like, for a while just contracting your abs is going to be okay. But then what happens when you need to go grab them like a football because they're about to run down the stairs, or, like all these other things that are probably going to happen and stuff too, is kind of like what I love to teach about that. But I could go on a rant about that.
I know, me too. It's really bad. It's bad. But like, again, like great, Alyssa, like this one of your clients, right? She might, like, again, she might have not had pain, right? And I think that's the big thing, that we just keep advocating for these healthy ways to do things that are going to be good for your back, good for your hips, et cetera, so that people know this ahead of time.
Yeah.
And and I'm going to go back and recircle to our, preventative medicine not being covered by insurance. I'm telling you that how much would it cost for me to be like, okay, if you do this and carry your kid this way and you will not have pain, and I can almost guarantee it, like, what is that to you? What is that to you if I can give you that information ahead of time and almost guarantee that you'll never hurt your back if you do it that way?
Yeah.
And I think that like people don't look at it like that sometimes because they're not in pain, or they just don't know, which that's what we're there to help them, is to teach them that, right? Like, we want to teach them how to do things biomechanically correct so that they don't have to be in pain later on. Totally. Which sounds silly because it's like we're losing patients, but no, that's not what it's about. Yeah. It's about helping people.
Of course. And it should always be about that. But like, you and I know, of course, that a lot of people don't think that way, and they're going to say, oh, like, we are losing patients, blah, blah, blah. But no, it should never be like that. And I would say I'm guilty of that too. Like, I don't go see a doctor sometimes until like something is wrong. So like, I do understand a lot of people's mentalities about that. Yeah. But now, especially seeing like how my patients are with certain things, I've gotten so much better about that too, where I say, I'm like, no. I gotta go because like I just have to get checked even if nothing is wrong, even if nothing is wrong. And I am seeing more and more now. I had an evaluation the other day. She was like, I don't plan on being pregnant anytime soon, and like I don't have painful sex, but I'm like a woman, and I saw that pelvic floor PT can be helpful. Like, what can I do? Oddly enough, she had like some postural things going on. She actually did have a tight pelvic floor, even though she didn't really present with symptoms or anything too. So like, I taught her how to relax her pelvic floor and to like kind of break certain habits that she's doing. She does work at a desk, and it like, after that evaluation, I was kind of like, wow, like people are starting to like advocate for themselves a little bit more. Like, she didn't wait for a problem to happen. She went and she was like, I've just heard about this. I thought that it would be good for me to get checked out. And that was that. And, it was kind of one of those, like, one-time sessions. And she even, like, emails me after. She was like, can I just, like, pop in every once in a while? And I was like, yeah, 1,000% you can, just to get checked. I think that's amazing. So it's like, I haven't had somebody like that in a really long time. But I was like, you know what, though? That's at least one step forward. It's, like, one step forward in the right direction. Yeah. And I think it's amazing. But like you also said too, insurance is another huge issue. I actually try to educate my patients on that all the time. And what I tell them and what I let them know is that like, I'm always going to try to I'm always going to advocate for you and like I will always do what I need to do on my end, like write whatever I need to in a note, for this to get covered, or call insurance companies, call your doctors for a prescription. Like, I'm always going to do those things for you as best as I can. But unfortunately, sometimes things aren't covered. But then I also educate them on, listen, you don't need to come in here every 5 seconds. Like, that's not what I'm asking you to do. However, I do know that you will benefit from these sessions. So whether we do it once a week, once every other week, whatever it is, I am asking you to try to pay out of pocket with our, with the offices I do work in. We do luckily have like a payment plan situation that people can do too, where we try our best to have it work. But then there's also that line of like, we also do deserve to get paid, as well.
Well, that's the thing too. Yeah, it's finding that line,
Yeah, definitely. But yeah, there's a lot of stuff that I think needs to be worked on. But then that's also why we're doing what we need to do, right?
Heck yeah. Power to the pregnant postpartum ladies.
That's
right.
I
mean, we got to keep advocating. We got to keep getting the word out there. We're on both sides, right? We're on the side of someone who we don't want to say to us, shoot, I wish I knew, right? Like, that's like the worst feeling. And I had a client come in the other day. She's 2.5. Her child's 2.5 right now. And she's like, I think I want to have another one, but I still don't feel great. She's seeing me. She still has a little bit of a diastasis. And I was like, listen, we're women. And sometimes we suck in all day long, right? Because you got to maintain an image, but holding that pressure in is just going to cause dysfunction. I explained out everything to her and whatever. She came back to me a week later. She's like, I had a breakthrough. I hold in my stomach all day long. What am I doing? And she does have pelvic floor tightness, and she does have other, incontinence things going on, et cetera, et cetera. So I was like, you know what? Like, if I could just help one person have a big breakthrough, like, that's just going to she's going to go tell other people, hey, go earlier. I wish I went earlier, but she didn't know until 2 years after having symptoms.
Right.
So it's good to just even change that one person, and she'll go out and tell other people. And I think that's like our mission, right? Like, that's what we're trying to do for everyone.
1000%. And like, that's usually like where my patients come from, though. It's like a lot of word of mouth type of stuff. And that's where I think like Instagram is very important, like having a website to go to. And with that being said, where can everybody find you, Jules? Just so they can find, because I even have I have a lot of course, moms that come to see me. A lot of women, whether you're a mom, pregnant, whatever it is, a lot of people that do come to see me. But where can people find you? To start working on that postpartum bod.
So, pacerphysicaltherapy.com, and Pacer Physical Therapy is my business name. And just on there, you'll see that I offer running programming, pregnant, postpartum, and anyone who after an injury needs to get back into running safely, have a customized program for you. Then I do membership programs where I know you're busy moms, like you just have a child, you just want something to follow that's going to be easy and simple. Join my membership plan. It's easy to follow. Everything's in a Google Doc. I try to make everything simple. And then I do one-on-one training and PT on there too. So check it out. Let me know. Happy to help anyone out and give you a free consult and any questions I can answer.
It's free. A free consult.
I want to give you hey, as we talked about today, we're just trying to get the word out. So any questions, I don't want anyone to feel shy. Out of anyone in PT school, Alyssa, you can go to with any question. And she does not, she's just like, nothing's TMI to Alyssa. It's like, okay. But seriously though, you made me feel comfortable with that too. I'm like, all right, why? And I think that was my hesitation to get into this realm. Like, if you talked to me 3 or 4 years ago, I'm like, oh, I don't know if I could talk to people about that. But then you realize you're like, we all have these areas in our body. They need to be spoken about. And I think that's another thing that I love, that women are feeling more comfortable talking about it. And just know that you can have a safe place, right?
Yeah.
And a safe space to talk to people about. So
yeah, of course. Yeah. It's funny you say that, like, because it's true. Like, there really is no TMI with me, like, at all. And all my friends
Zero.
know this. My family knows this, which sometimes makes them cringe a little bit. But, but it also know, though, we also are very well aware when something is uncomfortable to talk about, so it's like, if you don't feel comfortable talking about something, that's more than okay. However, if it's going to help you, then of course we're going to ask you about it, to make sure that, like, your health is at its optimal level. And that's always our goal. I think, like, we took away a few points from this episode in general, is that, like, there needs to be more advocacy for a bunch of different populations, and we kind of focus on postpartum women in this one for sure. And I think, like, I would definitely say it's one of the biggest ones. And my reasoning for that is because women are kind of looked at as, like, we should be pumping out children. And, so, like, that is just, like, a definite thing that is kind of known for us. And unfortunately, people then look at it as, like, oh, like, this is your body now, though. No, it's not.
Your body,
like,
your body changes when you have kids, but
right.
Your goals and your fitness goals do not need to change.
1000%. And, like, you don't need to be in a certain amount of pain just because you had a child. Like, is there that level of pain that is most likely going to happen postpartum? Yes, of course. Of course, like, you just had a kid, whether it's a C-section, vaginal, whatever it is. But that does not need to linger. It doesn't need to stay in your system. Like, there are ways to move. There are ways that we can help teach you how to move. And then that's kind of where we come in. That's where we come in and get on our soapboxes about education and women empowerment all the time and
all day,
stuff.
every day.
Yeah. But Jules, you gave a lot of good information. And even talking to you about this stuff too, it's like kind of just confirmation that a lot of us, like a lot of therapists, are kind of like in tune with what's going on. We kind of think on that same level of, like, movement is medicine. You do have to keep moving in order to get your bodies better. And thank you for being on here. I appreciate it.
Oh my gosh, Alyssa, I'm honored. Seriously. I really am. I'm super honored. And anyone in the Boston area, on a side note, anyone in the Boston area who's looking for a run club and looking to just form more community, I'm partnering with Athleta, and I'd love to see you there. It's the Athleta on Newbury Street in Boston, and it's just gonna be fun. We'll go out running, try to, like, get everyone together, stay active.
Are you gonna send me free Athleta stuff? Because, like,
I see where you're at. No, of course. Anything for you. Thanks so much, Alyssa. Appreciate it.
All right, guys. So you heard her. Pacer PT. Look out for it. Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at @the_pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.